Perfect. Awesome. Well, thank you all so much for giving the time today. I'm excited to talk to you a little bit about VOT-ER and then the ins and outs of our badges we have here. So yeah, I'll just dive into it. Give a little bit of quick overview about VOT-ER and then hop in and regarding the badges, how to use them, how to get involved. So again, my name is Omar Sanchez Marquez, and I'm the Arizona Regional Organizer here at VOT-ER. So today I'll be going over an intro of VOT-ER and going to chat with you all about the link between voting and health, including talking about the social determinants of health. And lastly, I'll wrap up again with the VOT-ER tools and how they may be used, as well as how to get assistance and move forward when it comes to using them yourself. So I'll start quickly with the intro to VOT-ER. So VOT-ER is a nonpartisan, nonprofit organization working to integrate civic engagement into healthcare spaces. So we developed nonpartisan civic engagement tools and programs for pretty much every corner of the healthcare system, which includes healthcare workers, healthcare advocates, social workers, and medical students, all united by a common vision, and that vision being that healthy communities are empowered by an inclusive democracy. So we work to provide patients the opportunities to register to vote because the reality is much of our healthcare system and healthcare experiences are determined by the policies our elected officials implement. And your access and affordability to a myriad of different healthcare and mental health services are determined by who we vote into power. And as an organization, we aim to help build patient advocacy and the intersection between health and civic engagement. So definitely seeing this connection between health and civic engagement is really what gets us going and really started that vision of wanting to make sure we can bring this information and insight and assistance to these healthcare spaces. So again, we're proudly partnered with over 500 hospitals, clinics, healthcare associations, and organizations. On the screen, there are a few that we are very lucky to have the opportunity to collaborate with. But yeah, again, 500, super happy about that, and seeing those numbers go up throughout the year is amazing. So why do this work is a question we always tend to hear from a lot of people. So to give a better idea of how this looks like when it comes to unregistered voters who are eligible, approximately 51 million eligible people in the US are not registered to vote. So a big question is, why are there so many people unregistered? And one of the main reasons for this is that many people just have never had the opportunity to ever register to vote because they've never been asked to vote, to register. The research has shown that over 60% of adult American citizens have never been asked to register to vote. And at this rate, it's similar among both registered and unregistered individuals. So the most common context in which individuals are asked to register is at motor vehicle agencies, social service agencies, and other government offices. So if voter registration opportunities existed in their healthcare space, this percentage would change dramatically. And by making voter registration more accessible and convenient, healthcare providers could play an important role in increasing voter participation in our democracy. So I believe when most people get asked about, voting and where to register to vote, people think of a couple ideas immediately. They think of the motor vehicle division, DMV. They think of potentially finding a paper application, possibly at a local state government location, or they think about maybe attending an event, perhaps a concert, a sporting event, and there's always some amazing people there with the clipboard asking them to register to vote in that process. So a lot of situations can definitely be a little bit tricky for folks to find themselves in, and with time constraints as well as just not knowing exactly where to begin, where to start. That's always a concern for folks. So having the opportunity to bring this within a space that they already have so much trust in, for example, speaking to providers, speaking to staff, speaking to patients, fellow patients, who again have a strong care about health and being a participant of a community, and giving them this insight to potentially get them on the path of voter registration is a really key and significant. So again, why healthcare settings? Healthcare settings are an ideal location to register patients to vote because they reach a large, diverse population of people. When you look at the top three groups of people who disproportionately make up that 51 million unregistered voters, there are people who are young, low income, and people of color. And the majority of patients who are most negatively impacted by poor health policy come from those in those same three groups. So we look through this overlap between unregistered eligible voters and patients most marginalized by our healthcare system. And we believe we can start to transform these patients' healthcare experience by beginning to ask one simple question: are you registered to vote? And the health providers are trusted sources of information who already have existing relationships with their patients by asking patients if they're registered to vote. Healthcare providers can help to empower them to make an active role in shaping up their policies and conditions that affect their health. So this is particularly important for vulnerable populations who may not have access to the resources or information needed to register to vote on their own. So now we're going to voting and health. So voting is a powerful tool for advocating for what we care about, including our health. And research has shown that increased voter participation can lead to healthy communities by giving individuals more autonomy and a sense of connectedness through the democratic process. By empowering patients to think about how policy impacts their lives, we can give them this agency to make them informed decisions about their health. And additionally, addressing the social and structural determinants of health through the power of voting can lead to more comprehensive and effective solutions for improving health outcomes. And it's important to remember that healthcare is not just about treating illnesses, but also about addressing the underlying factors that contribute to poor health. So what are the social determinants of health? So the social determinants of health are a condition in a person's environment that has significant impact on their health, well-being, and quality of life. So these include a wide range of factors, which include housing, transportation, neighborhoods, education, job opportunities, and income, as well as having access to nutritious foods and physical activity opportunities. Also, the exposure to polluted air and water, as well as language and proficiency skills. So these factors can contribute to the wide health disparities and inequalities, with some populations facing greater challenges in accessing healthcare, education, and economic stability. So, Healthy People 2030, the National Health Promotion and Disease Prevention Objective set by the U.S. Department of Health and Human Services, recognizes the importance of addressing the social determinants of health and has set data-driven national objectives in 5 key areas: healthcare access and quality, education access and quality, social and community context, economic stability, and neighborhood and built environment. And it's important to note that simply promoting healthy choices will not eliminate health disparities. Instead, public health organizations and their partners in sectors such as education, transportation, and housing need to take action to improve the conditions in people's environments. So this includes addressing issues such as poverty, discrimination, and limited access to healthy foods, safe housing, and transportation. And by addressing these underlying social determinants, we can work towards improving health outcomes and reducing long-standing inequities in health. So 80% of what determines a person's health outside of the hospital and health clinic, social determinants of health play a major role in shaping health outcomes. Health professionals such as doctors and nurses are in a unique position to help improve patient health by addressing these underlying social determinants. So VOt-ER is a solution that allows health professionals to take action and make a positive impact on patient health outside of the traditional healthcare setting. By providing tools and training to help healthcare professionals register their patients to vote, VOt-ER helps to empower patients to take an active role in shaping the policies and conditions that affect their health. And health professionals can take an extra step towards improving the overall health of their patients by encouraging them to participate in a democracy in a nonpartisan way. This can help them address the social determinants of health and creating fundamental and change that leads to healthier communities. So, and additionally, when patients don't vote, campaigns are less likely to address their needs and resulting in negative health impacts. So this is a self-perpetuating cycle where individuals who are not registered to vote and do not participate in the democratic process become labeled as unlikely voters. And the result, campaigns do not make contact with them and do not address their concerns and needs. This lack of engagement can lead to feelings of frustration and apathy among patients and reinforce that idea that their vote does not matter or will not make a difference. So by breaking this cycle and encouraging patients to register to vote and participate in the democratic process, healthcare providers can help to empower patients by having a voice in choosing between politicians and shaping policy. So this leads to them becoming labeled as likely voters, creating more responsive campaigns that address the needs and concerns of our communities, and ultimately improve health outcomes. So healthcare workers play a vital role in encouraging patients to vote, and by doing so, they can help to break the cycle of disengage and empower patients. So one way civic participation improves health is by building social capital, which is defined as the features of social organization, such as networks, norms, and social trust that facilitate and coordinate cooperation for mutual benefit. For example, a study found that members of civic groups were more likely to be physically active. Belonging to civic groups expands participants in social networks, which made them more aware of opportunities to be more physically active in the community. And engaging in meaningful civic participation activities can also help when it comes to individuals developing a sense of purpose which may promote continued civic participation. So participation in the electoral process by voting or registering others to vote is an example of civic participation that impacts health. And a study of 44 countries, including the US, found that voters' participation was associated with better self-reported health, even after controlling for individual and country characteristics. In another study, individuals who did not vote reported poorer health in subsequent years, and civic engagement fosters social cohesion and supports health and a sense of empowerment, achieving more equitable health outcomes. And public health efforts need to address civic participation as a social determinant, and that's something that we definitely care deeply much about. So, and we can look at the how our health and our health of our democracy are deeply connected. When people vote, they exercise their voice as decisions to make a big impact on their health and the health of their family and neighbors. Analysis from the Health and Democracy Index shows a clear relationship between inclusive voting policies and better health outcomes. And states with more inclusive voter policies and greater levels of civic participation are healthier, and states with exclusionary voting laws and lower levels of civic participation are less healthy. But it is crucial to address the structural determinants of health in order to effectively address the social determinants of health. One key way to do this is by addressing the upstream causes of these issues. Voting is an important tool to achieving this, as it gives individuals the ability to elect officials who can shape the environment that they impact their daily lives and their health. And economic and social policies passed by elected officials greatly influence the availability, accessibility, and cost of health services to certain communities. By voting, individuals having a say on these issues, such as medication and prices and health insurance costs, that affect not only themselves, but also their friends and family. So now with the groundswell support, even the American Medical Association recognizes voting as a social determinant of health, an area we would take action in on the context of health spaces. So this is something we're very proud of, is we got a chance to work with the American Medical Association to determine that voting is a social determinant of health. So, something we're very proud of, and, something that we really got a chance to dive in last year, and hoping to definitely promote this more and have more folks know more about this. And our mission goes beyond simply increasing voter registration. It also includes boosting voter turnout. Studies have shown those who vote have a significant impact on how governments allocate their resources. When voter turnout is low and skewed by factors such as race, income, and demographic characteristics, governments tend to act differently than when a voter turnout is high and less skewed. So this suggests when disadvantaged folks groups fail to vote, elected officials are less likely to respond to their needs and concerns. This can be a substantial impact on the community, particularly in terms of the allocation of resources and shaping their policies. And by increasing voter turnout, we can influence the way government funds are spent and impact the policies that shape our communities and healthcare systems. Expand turnout could increase the amount of money that goes to distributing programs like healthcare services, education, public policy, welfare by a third. So data shows voter engagement by nonprofits has large turnout advantage when compared to voters in general electorate. We saw this in our own data. We've learned since we got started in 2019 that folks we helped register to vote had a high turnout rate by almost 20% as compared to traditional get out the vote organizations. And just confirming that healthcare-based voter access does in fact work. Not only are we getting more folks registered to vote, but we're also making sure that folks turn out to vote. So there's something very proud of to see is that work from within our organization tends to have a 20% increase when it comes to compared to other organizations. So again, one of the questions people definitely always ask is the legality of this. So is this legal? Yes. The National Voter Registration Act of 1993 allows hospitals to facilitate nonpartisan voter registration for interested patients. The same law also designated DMVs and other state agencies that provide public assistance as voter registration agencies. So that same law that helps DMVs, MVDs, has the opportunity to register folks to vote is a law that would definitely is equal and the same for places that are healthcare hospital settings. So yeah, we are familiar with what the ways that the DMV are equipped to register people to vote. And so again, that's that question of like, if this is the place that people tend to consider registering to vote, then we would hope that the healthcare spaces can have that equal opportunity to be like, oh, this is a place I can go to and make sure people get educated on making sure that they know that I can join in and learn about voting and register to vote. So why are providers so excited about VOt-ER? When VOt-ER surveyed the providers and medical students who got involved with their work, they found that an overwhelming number of providers got involved because they care deeply about addressing social inequities. Healthcare providers often struggle working within our healthcare system that doesn't help out the most vulnerable. Engaging with patients around civic participation has been an outlet for providers to making a positive impact for those patients. So again, we hear a lot of great personal stories about why people are passionate and why they care so much about putting this work in, not only the awesome work they do in the healthcare spaces, but also their care about bringing civic engagement to them. So we are already making headway on empowering each other to make an impact and go vote. In 2020, healthcare providers helped out over 47,000 colleagues and patients get registered to vote. So now, with a little bit of background after this, we'd love to now get into the tools part of our section here when it comes to voting. So VOt-ER is a great way for healthcare workers to demonstrate their commitment to voting rights and health equity, as it provides an easy and nonpartisan method for registering patients to vote. The problem is the program, is completely optional and won't disrupt the care providers provide to the patients. Additionally, VOT-ER is politically neutral, meaning it won't promote any political agenda or candidate. And it's a great way to empower patients and help tackle the issues of health disparities we witness in many spaces across America within healthcare and healthcare spaces. So again, well, VOT-ER is making it super easy for professionals at levels of healthcare systems to incorporate civic engagement to their spaces by providing compliant, safe, and nonpartisan tools like individual badge backers, digital posters, and patient handouts, and conversation starters on our website to provide support for professionals with the process of inviting their clients and community members to register and check their voter registration status. Patients are able to scan this QR code, text the number, a special number, or a link in order to provide different directed to user-friendly portal that walks them through the registration process. So saving saving the people time and energy while still allowing them to encourage voter engagement with their patients. So this is what I have here is my handy dandy badge here. I have a physical copy. And one of the great things is for anyone who wants to get involved in our work, they can go to our website to order a badge, a physical one for themselves, free of no charge. So all they do is just put quick info about your name, address, and things like that. And within a few days or so, a new badge will come to your house. And again, the great thing about it is folks can either use the QR code on the badge here. They can use the text link that, they can text the number that's on the badge here to get to this landing page that has all these services, or they can use the URL that's also underneath here, which also they can put on their smartphone, tablet, or computer to get to that landing page that has all these services for them. So that's something that we definitely love people knowing is if they wish to, they could definitely order one on their own. And if they want to order some for their team, whether that be a clinic, hospital, community health center, we offer those custom materials too on our website. And those can be ordered through the digital format. So that way, if you want to order hundreds or 50 or so, you have the opportunity to order them digitally. And then when you have the documents and files, you all can download them and either print them out or share them as you wish. A great example too we see is people having them use them as a phone wallpaper or having just as a saved image. So it's like the conversation happens in their workspace and they're like, oh yeah, would you like to register to vote or go on the path to register to vote? They can just open their phone up, show them the QR code, text link, or URL, and that's how the process starts. So folks can engage again in those three ways that I spoke about. And so that's something that we let people know is like, it's like some people like QR codes, some people prefer just, texting number, and other people prefer just getting a URL and then putting that on their phone or tablet or again, computer if they have access to it at the moment. And so, yeah, that's one of the great things is just like having the opportunity to be in that conversation, letting them know that there's different ways so they can engage with the badge. And with that happening, letting them know that there's a lot of helpful services that I'll come up in this next slide here. So scanning, texting, or visiting the website brings them to the landing page that they can click on for the appropriate option related to voter registration or voting by mail. So when they get to that landing page, what they see then is they see multiple options. So here on the screen we have here is the contact helpline, registering to vote, or registering for a mail-in ballot. So our go-to definitely, of course, is that voter registration button, where they click on the button, then they put some information that will help them get to that page where they can officially register to vote within the state of Arizona or whatever state provider may live in and provider patient may live in. But also too, if folks are already registered to vote, but they're like, you know what, I would love to have a mail-in ballot. That way I can not have to leave my home and then just have it arrive at my home and basically begin that voting process then and there. Also, along with that too is the contact helpline, which we're really happy about because a lot of people are like, "Hey, I would love to help out with this. This is something I'm very passionate about." But I feel like there's sometimes will be a time where like I get a question and I don't necessarily know how to answer it because maybe like I don't know the answer off the top of my head. It's just a busy day, so I don't know if we can have enough time because I need to see the next patient or the next person I need to talk to. So the great thing about the contact helpline is they click on that button and it'll send them to their message inbox where they can speak to someone within a wonderful organization that we partner up with, Vote Riders, and basically ask them any question they have about voting. And the awesome thing about this is that person who responds to that message will be a person who answers any question they have for them. And there isn't a worry about having to speak to a machine or a bot or anything like that. It's just a person who is like, hey, here's my situation. I have a question about this. And very soon they'll get a response from a team that's also like us, nonpartisan organization that, just wants to help people register to vote. So again, never feel discouraged about not knowing the answers to the questions because the questions will definitely be answered by the contact helpline in case you feel stuck or just are limited on time, of course. So one of the questions that we frequently are asked by providers is, that question about, hey, I really want to help out, but again, I'm not really sure how much, I know about voting. And again, that contact helpline is such a key part of what the work we do here and making sure people know that it's like, hey, you can feel this passion and care about wanting to make sure your patients register to vote, but you don't have to be a political expert, government expert, elections expert. Those answers will be there and it'll be provided by some wonderful people who have again that same focus of, hey, we want to make sure people are supported and helped out so they can go register to vote, they can go vote, they can go get a mail-in ballot, they can learn more about the elections too, which is something that we have happen in our landing page. Is during election season you'll see something on the lines of like, here's where to find your closest polling place, or here's where to find out more information about the candidates, and that'll be all presented in a nonpartisan way. So it'll just be like detailed information about like, oh, hey, here's who's running for governor, here's who's running for your Senate senator for your state or federal level. So yeah, a lot of great information. And again, super happy to let people know it's like if you register to vote, that's awesome. But there's a lot of other helpful tools that you can definitely use within our landing page. So since VOT-ER platforms guide voters through the process of registering to vote and requesting a ballot, that makes your task super easy. And you just help them get to the platform at some point during the visit, and that's the goal. And that definitely basically becomes a situation of however we feel comfortable bringing it up to them. One of the great things we see is people bring it up in different ways. Perhaps like we see like a office setting where while the patient is getting ready to speak to the provider or speak to whoever they may be meeting, they'll have a staff member come up to them and say like, hey, as you wait, I have a question about if you're registered to vote and if you'd love to get on that opportunity to register to vote. So with that being an example, we also see when people are in the waiting room and about to meet the person that they're going to speak to. That's another example too. Or also to that person that they speak to and then there for the visit, they'll have that one-on-one and it'll be along lines of like, hey, just have a couple quick questions, to start off the appointment. And that's one of the questions they may bring up. Also, two people sometimes feel comfortable asking at the end where they're like, hey, thank you for visiting. I hope you feel comfortable and better about your situation. Just a quick question. Are you registered to vote? And the great thing about too is sometimes we know that these things might not necessarily come off super easy, which one thing we're very proud of is on our website, VOT-ER.org. That's VOT-ER.org. Under the resources section, we have a badge user guide, which, has a lot of information regarding how people can, use the badges and more information regarding them. But also one of the great things too we have is like, for example, training videos, conversation starters. So again, and also like a helpful role play scenarios where people will be like, hey, if I'm speaking to someone who is interested in register to vote, but maybe they just feel disenfranchised by lately things going on in the world, or maybe they're wanting to speak to someone, but they're a little skeptical about voting, or maybe they're speaking to someone who hasn't voted in a long time, but they're like, you know what, I kind of want to get started, but I don't know how I feel about this. So different scenarios. So again, never feel as though there isn't opportunities to just find a way that to connect your story with their story. We have all these recommendations, of course, but letting you know that however you feel comfortable bringing it up to them is always the best thing, because whatever position you find yourself in, whether you're provider, healthcare worker, staff member, just anywhere in the space, these people you talk to have this great trust in you that basically has this opportunity of letting them know, hey, I'm speaking to someone that I trust so much when it comes to giving me suggestions and advice about my health, give me recommendations about what I do next. And so this opportunity of like, hey, I know this person, I trust them so much. They're talking to me about voting. They talked to me about it in a way that I felt really comfortable and calm. Yeah, let's do it. I'm not necessarily a voter, but let's go ahead and do it. So that's one of the great things we hear a lot, and very happy to hear some awesome stories in the state of Arizona since I've had a chance to work with your VOT-ER for the past year or so. So yeah, again, those conversation starters are on VOT-ER.org. Again, that's VOT-ER.org. So again, the website has a lot of great content that again has conversation starters, has other ways in which people can practice when perhaps maybe they like have someone within their life saying like, "Hey, I think I'm gonna go talk to my patients about voting tomorrow, but can you like help me out practice a little bit regarding like potential scenarios where I can you know uh, practice and see how it might be if someone's speaking to someone who's skeptical, or speaking to someone who's like disenfranchised, or speaking to someone who is unsure or hasn't voted a long time. So a lot of the great things to definitely and again, always feel comfortable to talk about yourself and your connections to the work. So through your vote, you can say there's many things about issues regarding prices of medication or the cost of health insurance, things that impact them, and that you have the opportunity to connect with them that maybe you've spoken to about before. It's a hey, this is really important, and it has a way to impact your life in many ways, not just who's representing your state or who's representing your city or town, but also a lot of the policy changes that happen within the places we live. So we emphasize that few votes make a difference in so many elections, especially local elections to skeptical voters. We know a lot of folks sometimes feel their vote doesn't make a difference, and a lot of people feel that way in which is why a lot of people don't vote. So, well, the truth is that in those and the power to those who are interested and want to appease the groups of people that voted them into power, we need to make sure that our communities utilize this voice to advocate not just for themselves but also for the neighbors. We put the power back in the hands of them, and we decide who's in power, especially when we have a vote in and health in our minds. So that's one of the great things too. Definitely, is there was a lot of great uh, voter turnout last year when it came to Arizona efforts. And yeah, there was a lot of definitely close elections, both not only local but also statewide. And so seeing how close some of these elections came to, for example, the election sorry, for the election of Attorney General in the state of Arizona, that came down to a couple hundred votes. And having a chance to work on this voting efforts and helping about 1,000 people register to vote last year, it really made me see firsthand like, whoa, like we helped out 1,000 people, and there was an election that came down to a couple hundred votes statewide that impacted the whole entire state. That's very remarkable. And I had a lot of friends too that I work in this space, of course, and they're like, hey, it's awesome what you do, but like I don't think voting's for me. I just have this idea about my voice and things like that. And it's definitely hard to hear that from your friends and people but sometimes you just got to be like, you know what? I hope that through this work that we do, and through looking into more elections and just seeing the impacts results can have, maybe I can change your mind. So for those few friends who had that impact or had that idea, they got to see those super close elections happen last year, and they told me like, you know what, now I feel like this is my first time voting, but I'm going to do this now more often because I just realized like there's like some big seats, but also seats that maybe are smaller but impact me locally, and now I kind of want to get more involved. So to me, that was, I think, on top of all the awesome work we do here, just having that one-to-one connection within someone I know already in my life, it's like, whoa, like, I am very much happy to, continue the work I do and make sure that people know that sometimes elections can, be results of a landslide, right? They can be hundreds of thousands of votes, tens of thousands of votes, but sometimes you'll be surprised. And I sure was last year when sometimes elections can be just a couple hundred votes, sometimes even less, honestly. So, can't for the folks who perhaps you may know, who again can't can vote, perhaps through their legal status and documented status. One of the most effective steps you can take is to talk to them about, hey, while you can vote, I'm sure you have a lot of people in your life that you wish to help, register to vote. Would you mind, sharing this information with them? And yeah, you'll hear many people talk about, you know what, actually I have someone in my life who does, and I would love to share this information with them. Not only do you have the opportunity to help them out when it comes to helping someone in their lives, but also you help empower them too by saying like, hey, you know what? Like, while I can't vote, I know someone in my life who can, and then them sharing that information with that person who can vote. Not only do they feel empowered, saying like, wow, I just really helped out my community by like, I can't not be voting, but someone else is going to vote. Um, Not only that happens, but also another thing too is that person who can vote. Maybe sometimes I've been asked plenty of times about registering to vote, right? But they're in the situation where it's like, hey, I'd rather not vote. It's not my thing. When they hear that from someone who can't vote, and it's like, wow, like my friend or my family member who cannot vote told me about this resource about VOT-ER, told me about the landing page, about the badge. They really took that extra step to make me want to register to vote because I want them to know that how much they care about me and registering to vote. I care about them and having a voice where maybe they don't have a voice in this regard when it comes to electing officials. So that's something we definitely talk about. Is again, I always have this phrase: is just because someone can't vote doesn't mean they don't have people in their lives who can. And that's one thing that I definitely love letting people know. So again, taking action now, and so I'll definitely have these resources included through this chat here, but also send them in through a follow-up email. So again, ordering a badge is free of no charge on our website. Again, just putting in your name, address, and very much soon it'll get to your home. And then while you wait, there's also digital materials that you can order, perhaps for your office, healthcare space, place you just work in. And then you could say something along the lines of like, hey, everyone, I went to this training, I went to this speaking engagement, and I learned about VOT-ER, and here's some more information about it. Would love to have you all, try out the digital badge, and if it's something you feel like you can incorporate with your work, awesome, and more power to you. And again, knowing that support there's plenty of practice when it comes to conversation starters, badge training videos, and role play videos, all on our website under the resources section. And yeah, a lot of great stuff there. So again, one of the great things here, of course, is we have the opportunity to scan QR codes for more information when it comes to badges. And again, this information is all available on our website. And yeah, and the last part here I want to share about this presentation is just that this month is Civic Health Month. This is something that we at VOT-ER really, have a strong care about, and we have a lot of great, fun, informative events when it comes to digital format through Zoom, such as a Zoom session we have here. So yeah, if you all are interested, I'll definitely leave the information here when it comes to attending these events. Again, we have some great ones coming up next week, and then up until the end of the month, and actually till September 1st, actually. So yeah, a lot of the great things here when it comes to like practicing approaches to strengthening civic and voter participation, or just learning more about the process and the importance of voting. So again, we're really happy to promote Civic Health Month because it's the opportunity to have a whole entire month letting people know it's like, hey, while elections might not be happening at this moment, it's never a bad time to talk about voting and the importance of why getting your family, friends, coworkers, patients involved. So yeah, for now, that's the presentation on the side. Of course, I'll leave the screen here in case you wish to take a screenshot of it or anything like that. But I'll definitely send up a follow-up materials when it comes to through email or information in that regard. But yeah, no, that's basically the ins and outs about the VOT-ER badge. Again, physical, digital, along with materials that you can have in your office, like posters, screensavers, wallpaper. Also, I'll include it in the digital material section of our orders. So yeah, that's one of the great things we have here. And again, if there's any additional questions or anyone who couldn't make it today, who would be interested, please feel free to connect with them via email or share the email with me, and I can connect them too. But yeah, that's all for I had the presentation at the moment. Wanted to open up to any questions.